Hello, my name is Dr. Shane Watt. I'm the treating physician and doctor at Neurobolic Health Center. My office is located in South Jordan, Utah. Phone number is 801-495-4444, and you can reach me at whatisupdoc@yahoo.com. Now, what we're going to do is today we are going to do Thyroid Easily Understood Part 2. So let me go through this really quickly. There is Part 1 that you want to review, and that goes into really good detail on thyroid, how it functions, how it gets into the cell, the 10 metabolic steps it takes to get there, and a lot of really good information. This is going to go a little bit farther. So if you haven't seen Thyroid Made Easy Part 1 on YouTube, please go back, watch that first, and then come to this one, and part 2 will be better for you, and it'll help you understand things a little bit more, but you'll have a better basic understanding of thyroid function. Okay, so like I said, please review Part 1. So I'm just going to do a real quick review, and then we'll get into the heart of this discussion. So let's go through this. Hypothalamus stimulates TRH, which is thyroid releasing hormone. It sends it to the pituitary gland. The pituitary gland then sends a hormone called TSH, or thyroid stimulating hormone, to the thyroid gland. Now the thyroid gland creates two hormones, and it does it by what is called TPO enzyme. TPO enzyme allows tyrosine and iodine to get together, and we create T3, which is the active, which is what we need, and T4, which is inactive, but we create 93% T3. So now we have to get on the thyroid bus, is what I call it, thyroid binding globulin, and that takes the T4 to the liver, where 60% of T4 gets converted into T3. It also takes it to the gut, where 20% gets converted into T3. And then we have the active form of T3, and that's what gets into the cell. We have to have a proper cell receptor site, as well as the hormone, and they have to fit properly. It's like a key and lock mechanism. It has to work exactly, otherwise it doesn't get in. The hormone allows for metabolism of fats, carbs, and proteins. Now, this is discussed very much in detail in Part 1, so please, once again, review that first. I'm going really quickly over this. If there's issues, these are the things that don't get caught in the medical model because of the way they do things. If there's issues in our hypothalamus, issues with dopamine and serotonin, which are happy neurotransmitters, we don't get proper communication to the pituitary gland. If we have problems with cortisol, it decreases our responsiveness. Now, cortisol is our stress hormone. Think about it. Who's not stressed? If we're rich, we're stressed. If we're poor, we're stressed. If we're fat, skinny, whatever, it doesn't matter. In today's society, most of the people we deal with are stressed, correct? Now, that thyroid hormone that comes out as T4 and T3, we only produce about 2 tablespoons of thyroid hormone per year. That's my understanding. That's not a whole lot. So if that's all we have, and it's got to get to every cell of our body every day, there can be a lot of problems. If we have progesterone, decreased progesterone, it affects the TPO enzyme. It doesn't allow it to function properly. In the liver, if we have increased cortisol, which once again is the stress hormone, decreased selenium, decreased zinc, or increased testosterone, we can also have problems in the liver in that conversion process. In the gut, we can have all kinds of problems. One of the major ones is this enzyme that's called intestinal solvutase. That's what allows you to get T3S and T3SP. Don't worry about those, but we have to have proper enzymes in the gut to be able to break down and to be able to get that conversion from T4 to T3. Now, in the cell, we can have all kinds of issues. We can have problems with fatty acids. Our outside layer of the cell is a fatty acid. Well, it's not fatty acid, it's a lipid bilayer is what it's called. So we have to have proper fats, and unfortunately in our society we eat too many bad fats, too many good fats. So it's like a 20 to 24 to 1 ratio, so it's not very good. We got to have proper vitamins. We have to have, if we don't have, we don't want homocysteine. Homocysteine is inflammatory, and that creates a barrier from the T3 getting into the cell at the cellular level. If we have too much estrogen and too much plastic, it affects that as well. So plastics are xenoestrogens. So this is a quick review. Once again, please review part 1, and that will give you a whole in-depth answers to these questions and also a very good functionality of how this all works. Now, as I was saying in part 1, 70+% of you, all this info may not even be your problem. Okay? What is? Well, the biggest problem is autoimmune. And unfortunately, it's never checked, or very rarely is it checked. Hashimoto's is what it's called. So, Dr. Hashimoto in 1912 discovered Hashimoto's. He named it after himself, right? That's what a lot of the diseases they used to do in the past. It's autoimmune thyroiditis. It's when TPO or TBG antibodies are found in the blood. It's a very simple test. But the question is, have you been tested? Most people have not. And yet, the high majority of thyroid, as we talked about, 70+%, have autoimmune Hashimoto's. What does that mean? Well, an autoimmune condition is drastically different than just a thyroid condition. And we're going to go into that in great detail here. So what is an autoimmune? Autoimmune is when your body's system gets disorganized, it gets confused, and it starts attacking itself. So think about that. Your body's immune system gets disorganized, confused, and starts attacking itself. Now, that's not good, but that is what autoimmune diseases are. Now, a lot of these you've probably heard of. You've probably heard of rheumatoid arthritis, ulcerative colitis. You've heard of multiple sclerosis. So an example, multiple sclerosis is, let's just say you have a nerve. My arm's the nerve, and my skin around the arm is that sheath, that myelin sheath. Well, your body starts attacking the sheath. And now we have holes in the sheath, and therefore our communication in the nerve doesn't work as well. And we have breakdown in our nervous system function. In rheumatoid arthritis, it attacks the cartilage in the joints. Hashimoto's, it attacks the thyroid gland. Now, I want you to understand this. This is very important. Autoimmune diseases are genetic. Now, let that sink in for a second. Autoimmune diseases are genetic, but it doesn't mean you have to get them. Just because you have the genes doesn't mean they have to be turned on. So what turns on your genes for Hashimoto's? Well, the number one cause is estrogens. Estrogen. That's why in autoimmune Hashimoto's and thyroid problems, it's about a 24-to-1 ratio women over men, because women's cycles are always fluctuating, and they're fluctuating drastically during different times of their life. So the first time it can hit is in puberty. Okay? Now, a lot of times a girl's doing really well, all since she starts going through puberty and everything changes for her, and parents like, she's just gone boy crazy. Well, sometimes there's other things going on. In pregnancy is the other time. I can't tell you how many times when people call my office when they're seeking help and we find out some information on them, one of the most common, I would say bar none, is women's answer to a question is, well, when did this start? And people are always saying, well, it was like after my first pregnancy, or very commonly after my second pregnancy. What happens is you have your baby and you don't lose the belly, you don't lose the baby fat again, or you just don't have the energy. And people are like, oh, it's because you have 2 kids and all those kinds of things. And yes, that plays a role for sure. But you just don't feel yourself again. You go into your doctor and your doctor says, oh, it sounds like you got postpartum blues or postpartum depression. Here, let me write you a script. And they give you a medication for your postpartum. There's more to it. And that's the problem that we see in a lot of times when patients have just gone in the medical route of dealing with these type things. They haven't been offered anything other than a prescription. We're going to offer a whole lot more. Now, another one is menopause. That's the other time when our estrogens go out of whack, okay, is estrogens. One thing I want you to understand is 80% of your immune system is in your gut. So when we have gut function problems, which unfortunately most of you do, we can have autoimmune issues, but not only autoimmune issues, we can have immune system issues. So I want to explain real quickly the gut and how it works. And I want to thank one of my colleagues who is on the neurological board with me. He's in California. He made these next few slides, and I thought they were good enough that he said I could borrow them. So I appreciate Dr. Tomlinson for doing that. So this is our gut lining, and this is our bloodstream. Okay? And we're just going to do a little diagram here. So these right here are called tight junctions. And what they do is they make sure that too big of particles don't get into the bloodstream. And then we have some other junctions. We have some, I'm going a little too fast, sorry. These right here are some additional junctions. So we have 2 layers of protection. Now those are called adherence junctions, and that's the lower ones here. We also, now we have proteins, fats, and carbohydrates. They need to get into the bloodstream, right? That's how we get energy, right? This is all done mostly in the small intestines. 90% of our absorption is done in the small intestines. Now, we have protein molecules, fat molecules, we have carbohydrates, but even with that, they still need to be broken down, otherwise they're not able to get into the system. And that's because we have these tight junctions. So that's good. We don't want too big of molecules in our bloodstream. So they need to be broken down, and now they can get in because they're smaller. Does that make sense? Now, we have some other problems going on. Part of the reason that we have issues is because we have breakdown, and that's where we're going to get to real quickly here. I'm trying to get this to go a little faster. Now, then, so it gets into the bloodstream. That's our normal barrier function. Now, if we have issues with that, we have fast foods, we have coffees, we have GMO foods, medications, NSAIDs, all these other things that come up, they can affect our tight junctions, and they can allow for bigger molecules to get in. Okay, we get infection into the gut or different things, and we're going to get to that in just a second. But what happens is it causes inflammatory response, which opens up those tight junctions and those other junctions. And so therefore, things get into the bloodstream that aren't supposed to. So those proteins, now, even though they're too big, normally wouldn't get in, but see how these are separated? Now they're able to get in to the bloodstream. And once they get into the bloodstream, our body doesn't like that. And when our body doesn't like that, it starts attacking. Okay? Now, other things that can happen is we get bacteria, viruses, and toxins that now, because we have an open junction, we have the ability for them to get into our bloodstream, and we have issues. Does that make sense? That's part of the reason. A lot of times you've heard of this referred to as the leaky gut. So that's a real quick definition of what's going on. Once again, I want to thank Dr. Brian Thomason for letting me use that. So the second genetic turn on is inflammation. We just kind of talked about all those things we were talking about before. In the gut, when there's inflammatory responses going on, that's when those tight junctions now no longer stay tight, and they become larger, and so bigger molecules get in. So the biggest thing is food sensitivities. We have gluten, dairy, and soy are the biggest 3. Now, unfortunately, gluten is the number 1. And I hate to tell you this, but it just is. And gluten, unfortunately, is found in a lot of things. It's not gluten, it's what is called the gliadin molecule. So what happens with that is the protein, the gliadin molecule, then goes through into the no longer tight junctions, gets into the bloodstream, and what happens? Our body thinks it's foreign, so it starts attacking it. And after a while of attacking it, that molecule starts looking like other things. And in Hashimoto's, it starts looking like the thyroid gland. And then the thyroid gland starts being attacked, and that's autoimmune Hashimoto's. Now, number 3, another big one, still in the gut. so once again, the gut's very, very important, is parasites, bacteria, viruses that hide in the gut. We just like to call them critters. Well, what happens? They can be the antigen to turn things on. Sometimes it's not the thing, it's just what we refer to as the antigen that turns those genes on. So we have parasites, bacteria, and viruses. Trauma is another big one. Now it can be emotional trauma or it can be physical trauma. Emotional trauma like substance abuse, physical abuse, sexual abuse, things of that nature, but also physical trauma like car accidents, injuries, things like that can just set off that autoimmune condition. So what makes my approach different? And why does my approach work? Well, we are different. We're drastically different. In the medical model that you've been dealing with, your doctor has gone after the thyroid gland. And he really hasn't even gone after the thyroid gland. If you watched part 1, I talked about how the thyroid gland, they go after the TSH, which is actually a pituitary stimulating the thyroid gland. They really don't go after the thyroid gland. And your medications for those are only partly effective. In fact, only about 15% of patients really get just plain old good response from just taking a medication such as Synthroid, levothyroxine, one of those. Majority of people, they get those medications, they might feel better for a couple months, but then they start having the same problems. The reason is it's not a thyroid problem. It's a whole body problem. It's possibly an autoimmune. It can be a gallbladder. It can be brain chemistry, adrenal gland, which is huge for thyroid. Most people, their adrenal glands are shot. Progesterone, estrogen, which we talked about. Adrenals is the cortisol. Progesterone, estrogens, we talked about a little bit earlier. Blood sugars, digestion, leaky gut, which we just referred to, brain function, diet, all those things affect the thyroid. What do? We do proper testing. Most medical facilities don't do proper testing. And let me explain why they don't. It's not going to change their protocol. You can go to the best endocrinologist in the state, and that gentleman or lady is not going to do anything for your autoimmune condition. How do I know that? Because my patients didn't believe me, or their spouses didn't believe me, and they wanted to go talk to a medical doctor about all this. And they, sure enough, doctor said, no, we're not going to do anything about the autoimmune condition. And in fact, they don't do anything about anything else. They look at it separately. And unfortunately, that's part of the problem. We look at it globally. So we do proper testing. Generally, if you go get blood work, your medical doctor wants you to do your yearly physical or whatever, they do a couple of things. They take your blood. They usually take 2-3 vials. Well, when we send our blood work in, we take about 12 vials. It's not done in my office. We send you to an actual lab, and you get that done. But think about that. If you want your doctor to be the best detective, which is what you're hiring me to do, you want me to have all the information. And 2 vials doesn't cut it. In the thyroid, they generally check for TSH, possibly T4, and most of the time that's if you're begging them. We check up to 9-10 different thyroid markers, including the autoimmune markers. One thing you need to understand, in the blood work ranges, when you're looking at lab ranges and you get your blood work done, those ranges are, in my opinion, and in a lot of functional medicine thought processes, are skewed. Let me explain why. Who goes and gets blood work done? It's generally yearly physicals or sick people. So the majority of them is sick people. And if that's the case, they do it off of what is called a bell curve. So that curve can expand. So when you go to your doctor, like a simple example, TSH, most areas about 0.5 to 5.0. Now that can vary. ABC lab, it can be 0.5 to 5.0. XYZ lab, it can be 4.85 to 5.36. And it just varies. So that does vary depending on the lab you go to and their ranges. But everyone knows the abnormal ranges. Those are the ones that are out of question high. The problem is when you're in this area, the medical model says, hey, that's within normal limits. So As an example, TSH, we like to see between 1.8 and 3.0. So if you're 4.85, and according to that lab, that TSH score is good. Your doctor has nothing to go on because it's within normal limits. Does that make sense? That's why there's so many people that are within normal limits that still don't feel good. They know they've got a thyroid issue. They've Googled it. They've looked on the internet. They've done all these things, but the doctor won't do anything because they can't do anything because their lab tests are normal. Now, as soon as you get to 5.1, like if you're using this scale, all of a sudden now they can do something. It's like diabetes. They don't do anything for you until you're 127. Well, shouldn't you have been doing something at 125? Does that make sense? So we look at the functional ranges. Now, one of the other tests we do is a cortisol test. We do this. It's called the Adrenal Stress Index test. Now, this is a spit test. You do it with 4 different vials throughout the day. Why is that so important? Well, your cortisol levels should be high in the morning and low at night. Why? Because you should wake refreshed in the morning and you should be tired at night. It's inversely proportionate to melatonin. So if cortisol is high, melatonin's low. And then it flip-flops throughout the day. Does that make sense? Now, a couple of things. If you go to your doctor and they say, oh, we can do a cortisol check, they check it one time and it doesn't matter which part of the day. And they're like, oh, see, it's within normal limits or it's just a little bit high. But they don't check all 4. Cortisol is a fluctuating hormone throughout the day. Wouldn't it be best to kind of see what that fluctuation is? Well, I think so. So we do proper testing of the adrenals. Also, one of the other big ones we talked about was being alert, having food sensitivities. Now, there's a drastic difference between an allergy and a food sensitivity. Allergy is throat swells up, can't breathe, you got to go to the hospital, that kind of thing. Sensitivity is what we refer to as the silent killer, because a lot of times you don't even know it, and it's eating away your gut system. It's causing inflammation, all kinds of things going on in your gut. And a lot of times you might think, oh yeah, man, I've got some stuff, yeah, I can't eat that anymore, and I can't eat that, but there's more to it. This is the old way to check for allergies. We're not checking for allergies. We're checking for food sensitivities. And we use what is called a Cyrex lab. And that's the #1 functional medicine lab in the country. Why? Well, you got to check for a lot of things. Like when we're checking for food sensitivity for gluten. Gluten can be very pro-inflammatory. It can be a neurotoxin. It can be immunotoxic, cardiotoxic, cytotoxic. It affects and disrupts the endocrine and gastrointestinal function, interfering with genetic expression. That's all just in the gluten molecule. So when we test, if you go to your doctor, once again, they do, oh, we can check that. They check one antibody. One. When we check, this is the test we get back. This is just for gluten sensitivity. It has how many different things? About 20. And we can see if they're in range, if they're out of range, or if they're questionable. That's huge. It's not just the IgG molecule. It's all of these. Do you want a detective that's going to help you get the results you want, or do you want to stay in the medical model that hasn't helped? You got to change. You got to get out of that system in order to get real help. Because if you didn't need the help and it was working for you, you probably wouldn't be watching this. That's how I know you need to get out of that system. Now, another one that we do is a stool sample. If you go in with gut aches and things like that, medical model is going to do a CAT scan, ultrasound, MRI, and say, hey, you're fine. But you keep on having issues. So what are those issues? Well, we got to check for parasites, bugs, bacteria. It's a stool sample. You do not bring that into my office. It's a home kit. You send it off. The FedEx comes and picks it up from your house. Okay? But we got to know what's going on in the gut. We got to find the critters. If there's critters, you got to get rid of those. Now, a lot of people have this ego thing going, oh, I don't have any parasites. I don't have any of this stuff. I've never traveled. I ate fine, all these things. Doesn't matter. You can still have issues. You can go to Mexico and not have a problem, and yet you can go to just south of us to Arizona and have an issue. It doesn't matter. You can still get these things. So we check for those things because we got to find the cause. We got to find the antigen. What is causing your problem? Now, for females, and once again, most of you that are watching this are females, or most people that come into our office are females. If you're cycling, we do a full 28-day cycle panel. Now, that right there should pique your interest because most of you have had your hormones checked. When do they check them? One time throughout what? The whole month. Didn't matter when they did it. Now, don't you find that a little bit odd? Because isn't your levels of hormone different throughout your cycle? Absolutely they are. Absolutely they are. In fact, when our estrogen peaks, it peaks so that you release an ovum or an egg. Why? So that we can continue life as we know it, right? So we can have children, things of that nature. Well, if you don't ovulate, you don't develop a corpus luteum. And if you don't have a corpus luteum, your progesterone is trashed. So if you've been on the pill for a long time, your progesterone is probably an issue. Why? Because you didn't create the corpus luteum. You never ovulated. But we want to see that cycle. We want to see the highs and lows and make sure that they're in the right time. If you have a drastic, sharp spike or a drastic decrease in hormone levels, we can see it. And people are like, I get that migraine whenever I have my cycle, or that really bad headache, or whatever. Well, that's usually the problem. Does that make sense? This is a much better test. And wouldn't you think you would want to get the whole picture instead of just a little tidbit? So once again, back to this. We look at the body. I do not look at just the thyroid. I do not treat your thyroid. Your thyroid's been treated for 6 months, 6 years, 20 years, whatever, however long you've had this condition. I'm not treating your thyroid. I want to help your body's systems get turned back on so that you can have proper function, you can get back to the life you wanted and should have and should be able to enjoy so that you can do the things that you want to do. So, once again, my name is Dr. Shane Watt. My office is the Neurobolic Health Center. I'm located in South Jordan, Utah. My phone number is 801-446. That's my other number. 801-495-4444. I actually have 2 offices. This is the Neurobolic Health Center in South Jordan. 801-495-4444, or you can contact me via email at whatisupdoc@yahoo.com. Thank you so much for viewing this presentation. I hope that it's been informative for you. Please call. Allow us to help you. If there's other people you know, please pass this along. There's so many people that are suffering needlessly. Our goal is to help as many patients as possible that are caught in that standard medical model of doing things and not having success. But that's the thing you got to understand. If you want to have success, you have got to be able to step outside that comfort zone, that insurance-based model, and realize insurance isn't going to always cover for the things that we do. Why? Because we do things natural. We take it a little bit further. And we're not going to be worried about whether your insurance is going to allow us to do the test. We're going to get what needs to get done so that we can find the answers for you. Please call my office, 801-495-4444. Thanks for your time. Have yourself a wonderful and healthy day.